Hi, Strathcona County. It's your Mayor, Rod Frank. It's time for another Coffee with the Mayor, virtual coffee, of course, because we're in pandemic times. And I'm excited to introduce our guest today. It's Minister Nate Glubish, who's also an MLA. Welcome, Minister.
Oh, thanks for having me, Mayor. Happy to be here.
And Minister, you are Minister of Service Alberta, if I have that correct.
Mm-hmm.
Could you, well, I guess first of all, just tell us what part of Strathcona County you're MLA for, and then secondly, can you tell us what the Minister for Service Alberta does?
Sure. Well, so I'm the MLA for what's called Strathcona-Sherwood Park. So it's half urban, half rural. So I have pretty much all of the rural Strathcona County that's south of Highway 16. And then I have the urban portion of Sherwood Park that is east of Clover Bar Road. And that runs between Y Road up to Highway 16 there. So I'm one of the three MLAs that represents a portion of Strathcona County, along with my colleague Jordan Walker in Sherwood Park and Jackie Armstrong Hominuk for Fort Saskatchewan-Vegreville, who represents Strathcona County north of Highway 16.
Sorry, is all of your riding within Strathcona County, those rural parts also?
Yes.
Okay. Yeah. And as a minister, what are your responsibilities?
So Service Alberta is a collection of, about over 30 different acts and close to 90 different regulations. So I am in charge of everything from registry services. We regulate and oversee the registry network. I'm in charge of all of IT for government, so anything to do with technology, whether it be computers or phones or networks or software or hardware or custom solutions of any kind to allow government to operate. I'm in charge of that. I'm in charge of consumer protection. I'm in charge of the Real Estate Act, so I oversee and regulate all of the realtors and the real estate industry. And a whole bunch more. So it's an exciting portfolio. Every day's a little different, and never a dull moment.
Yeah, it sounds like a lot of responsibilities. Now, of course, we're having our coffee here in the context of the pandemic and the COVID-19 pandemic. And there you are chugging along in your first year in government. You've got all these responsibilities, and suddenly your table gets flipped upside down.
Mm-hmm.
How do you react to that as a minister? And can you give us a little bit of a peek behind the scenes? I'm sure it's chaotic at times. And how does the government shift gears? And how do you more particularly shift gears?
Yeah, well, that's a great question, Mayor. Certainly nobody could have planned for this or nobody could have anticipated that this was going to happen, a year after the last election. So it certainly has changed the day-to-day of the job. So, just some examples. I had a number of pieces of legislation I was planning to bring forward to fix some problems in my portfolio. Was working on a few things related to the real estate industry, related to the construction industry in terms of prompt payment issues to ensure that contractors get paid in a timely manner by their general contractor. And these are all very important things, and I was very excited to be bringing some of these things forward this year. Obviously, some of the stuff, because it's not related to the pandemic and the imminent public health challenges that we face, has had to slow down, and so that our government can focus its full attention on the pandemic, and then, of course, preparing for an economic recovery strategy that will be necessary once we turn the corner on the health side. So we've had to shift gears. I've had to reallocate some of my department staff to the Department of Health to help support them. But these are all important things to do to stay focused on the most urgent priorities to keep Albertans safe and healthy. In terms of my work as a local MLA, I'm sure this is very similar to what you're experiencing, Mr. Mayor. We've had to suspend in-person meetings, but we're still very busy by phone and by email, working hard to answer folks' questions. We get a lot of questions, and it's my job to make sure that we help the residents of Strathcona County know what is the government of Alberta doing, why are we doing it, and why is it important. to make sure that our residents have the most up-to-date and current information.
Okay, well, let's focus now, as you point out, all these responsibilities, you got all this exciting legislation and work you're doing, and suddenly it's all hands on deck, and the Alberta government has got to respond quickly, looking after public health, and of course economic aid, and then, as you say, down the road, the economy generally. But let's look at that public health aspect, and I know the statistics are very important, so because that's how you I guess you really, your strategy, are you flattening the curve or are you not, is the fundamental question. But how are we looking statistically?
Yeah, well, I think that's a great segue. If we all agree that, and I think we do, that the public health crisis, the pandemic, is the most important focus for our government right now. One of the important things to say is, how are we doing? Where are we at in terms of infections and the rate of the spread of the virus? So as of the date of our interview today, we're recording this Saturday afternoon. The most recent stats that we have today is effective of Friday's update yesterday. So as of that update, we had 239 new cases for a total of 2,397 across the province. And just to bring that to, close to home in terms of Strathcona County, I know, Mr. Mayor, you had tweeted out just recently that local to the county, you have 27 confirmed cases. But an important number there is that 21 of them have recovered. So that's some really encouraging news. But what are the really important numbers here to look at? Well, it's important to look at how many folks have needed to be hospitalized as a result of this, and that number is 60 so far, which is a very encouraging number. And even more encouraging is that only 13 have needed to be in the ICU. One of the big concerns that I've heard a lot of, and it gets talked about a lot since this pandemic has become the forefront of the public conversation, is, can our healthcare system handle this pandemic as it scales up and as when we reach the peak? And these numbers are very encouraging, and they're a testament to how seriously Albertans have been taking the directions of Dr. Hinshaw, our Chief Medical Officer, on the social distancing and, more importantly, on the self-isolation protocols. Those restrictions are there for a reason. They're there ultimately to save lives, and we're saving lives by slowing the spread and ensuring that our healthcare system does not get overwhelmed. So 60 people in hospital, 13 in ICU. That we have a lot of extra capacity that we've been building in the system, and we are in a very good position as of right now. So long as we continue doing the things that we're doing, then I'm confident that our healthcare system will be able to manage with room to spare.
Okay, well, that I do want to highlight those numbers once again in Strathcona County. 27 cases, so we've seen a great leveling off now, and we have 21 recovered, so that's fantastic news. As you point out, provincially, we seem to be flattening the curve as we want to do. So as you say, the public buy-in's been fantastic, and I thank the government for its leadership here. I thank AHS for giving us very clear direction, and most importantly, the citizen has taken this to heart. I think I saw up to 85% buy-in by the public, which is phenomenal. So wonderful news there. So we got to keep on doing this. And can you, I guess I want to touch on a couple things. How long are we going to keep doing this? And I know you don't have the exact answer, but what is the government thinking about where we're at on the flattening the curve, or when can we start to relax it? And I know there's also been some talk, what's going on? We're giving away some of our PPE. Like, is that a good move? So maybe touch on those two things. Sure.
Well, and I think, those are both great questions. And, ultimately, we know that these are questions a lot of our residents in Strathcona County have, and across Alberta have, because folks are wondering, are we doing the right things, and is it working? And how long? And as you said, how long is this going to take until we start to move back to some kind of normal. And while I can't give a direct answer in terms of when we'll be back to normal, because this continues to evolve day by day, I can tell you that the steps we have taken as a province, and all Albertans taking this seriously and practicing the recommendations of our chief medical officer, it is working. It's doing what we need it to do. It is flattening that curve. It is slowing the spread, and it is saving lives. Another important result of that is the better a job we do today, as individual Albertans, of observing these guidelines and washing our hands, staying home if you have symptoms, stay home if you don't need to leave the house. As hard as those things are to do, the better a job we do of that, the sooner Alberta will be in a position where we can safely begin to relax the restrictions and move towards some kind of normal. And so those decisions will be made by the Premier and the Chief Medical Officer, Dr. Hinshaw, and in collaboration with the Minister of Health and the great staff at AHS, who've been doing an amazing job so far of managing through this crisis. And those decisions will be made based on the data, science, the best evidence that we have to inform us in making those decisions. And as soon as we have more to say on that, those updates will go out as a part of our daily updates. Our Premier and Dr. Hinshaw do a daily update every day, usually somewhere between 3 and 4 in the afternoon. And that's available on the government website, on our government Facebook and social media channels. And you can also go and see archive footage of these updates at alberta.ca/COVID-19. So that's a bit of a long way of saying I can't tell you when we're going to be back to normal, but I can tell you that what we're doing is working. And I just want to encourage all of Strathcona County residents to continue to take this seriously as you have been. And if we follow those guidelines, we put Alberta in the best position possible to get back to normal as soon as possible, as soon as safely possible. And so, maybe it's something that might be helpful, though, to give a bit of context. I know our Premier did a bit of an update on some modeling a little over a week or two ago. And this helps to just maybe make this a little bit more relatable, because it's one thing to say, well, there's this many cases today and we're flattening the curve, but what does that really look like? What does that mean? Well, given the trajectory we are on today, so long as we continue doing the things we're doing, then what we consider to be a probable case is that, and in this case, we're sort of assuming that for every infection, then that would spread to between 1 and 2 more people. This would be, the kind of infection rates we're seeing in other well-managed jurisdictions that maybe had their cases a month before Alberta got its first case. And I think that so long as we keep doing what we're doing, that's a good proxy for us. And in that case, we think, early to mid-May is the likely peak. And there would be about a total of 800,000 infections. In this case, we would anticipate between 400 and 3,100 total deaths. And the peak hospitalizations at that time would be about 820. And the likely peak of those needing ICU care would be roughly 230. So that model shows that we are well on our way to having enough capacity in the healthcare system to meet those needs. In the event that the rate of infection escalates and we're having more than 2 infections, or more than 2 new people infected for every existing infection, which would be the result of people not taking the restrictions seriously, we would see a week or 2 sooner for the peak, and that peak would be closer to 1,060,000 infections, and the deaths would be between 500 and 6,600. And we would see the hospitalization requirements go up to about 1,570, and ICU requirements at about 390. These are we can meet those needs, but it just goes to show how important it is that we take this seriously, because if we can minimize the amount of folks needing to go to hospital, needing to go to ICU, then that's going to save lives. The sort of worst case scenario, if chaos breaks out, people just completely ignore the restrictions, and the spread accelerates, we would see an imminent peak here very quickly, with about 1.6 million total infections and between 16,000 and 32,000 deaths. So, again, tying that back to the probable scenario, if we continue doing what we're doing, of 800,000 infections. I mean, it's half as many infections, and 1/10 of the amount of potential deaths related to the illness. So this is so important. This does save lives. I've had lots of people ask me, like, does this really matter? I mean, I'm young, I'm healthy, I'm not at risk. Well, the reality is the decisions that every Albertan makes for themselves will impact other Albertans, because not everyone will be symptomatic. Not everyone will get very sick. But the reality is if this spreads without control, many, many people will die. So I just want to thank all Albertans, and especially, Strathcona County residents from our community here, for doing such a great job of taking this seriously and making very tough sacrifices with your families, your businesses. But we're doing this for a reason. We're all in this together. We will get through this together. And it's very important that we continue doing these important things.
Mm-hmm. Well, you've done your homework, and part of the takeaway from what you've said is that we are on track to handle this, that our hospital system will have the capacity. And so let's keep up the good work, staying home, washing our hands, physical distancing. Anything else, Minister, you want to pass on at this time?
So I'll just add quickly, I know you had brought up the PPE conversation,
yes.
And then I'll also talk a little bit about testing, because I think that's important.
Sure.
On why we can feel confident in the data we have. Actually, maybe I'll start with the testing. So as of yesterday, we had completed 92,805 tests. We are leading the country in per capita testing. We are leading the developed world. We are among the leaders of the developed world in terms of per capita testing. We have been innovators in developing new methodologies and new ways to test, so we can get results more quickly and increase our capacity. We did 3,831 tests in the last 24 hours. And we have now built our capacity up to be able to do 7,000 tests a day. And we continue to work to build that number. This is important because as the infection spreads and as we approach the peak, we need to be able to identify every person possible who actually is infected. And by doing so, we need to be testing folks who have symptoms and may be suspected of having the disease. And I'm happy to announce that as of this point now, every person in Alberta who demonstrates any symptoms can now get tested, and they can do so by going to the online self-assessment tool. If you do the online self-assessment tool, you won't even need to call 811 in order to get access to the testing. So that's the fastest way to get access to the testing. But you can also call 811 if you're not able to do anything online. So we have been investing very heavily in prioritizing scaling up testing, because the more people we test, the more certainty we have about who actually has the virus and who's just got a cold or a fever. And that way we can then trace all of the folks they've been in contact with and contain the spread. That's been our philosophy since day one. It's been working very well, and our capacity is escalating rapidly. So this is one of the things that gives me confidence that we're on the right track to protecting all Albertans in this pandemic. So in terms of PE, I just want to pay a huge compliment to our brilliant medical procurement staff at AHS. So we're very fortunate that in Alberta we have a single integrated healthcare system. Not every province in Canada is like that. And as a result, we have significant purchasing power, but a very robust and very competent medical procurement team. And as soon as we got wind of a strange virus in China, they immediately began placing massive orders for PPE, so masks, gowns, gloves, you name it. And as a result of their foresight and quick action and our world-class procurement system, we've been able to build a significant supply of the supplies that we need for our healthcare system, to the point where we have several months worth of supplies to deal with the pandemic, when our peers in Ontario and Quebec, in some cases, had only a matter of days of supplies. And so some of you may have seen our government's announcement recently to send millions of dollars worth of PPE to Ontario and Quebec to help them. But this is the right thing to do. This will save lives. It's something we can afford to do because of how proactive we were. But let me assure all Albertans and residents of Strathcona County, we have and will continue to have the supplies we need to meet our local healthcare needs through this pandemic. And furthermore, for all of the frontline groups, like long-term care facilities, pharmacies, charitable organizations that are on the front lines of supporting vulnerable Albertans in this time, they can get access to PPE through our provincial operations center, and they can contact us. If they go to our government website, alberta.ca/COVID-19, there will be a link on how to contact the operations center to request PPE. And I'm happy to confirm I had a good chat with Sherwood Care, a good local long-term care facility here in Sherwood Park, and they were able to confirm for me that they had already received the first shipment from the provincial operations center of PPE to help them as they're caring for their residents. So, there's a process in place to ensure that the PPE will go where it needs to go. We have sufficient resources, and Alberta is in a very strong position to make sure we meet these urgent needs. So just wanted to, hopefully that answers some questions that folks may have had as a result of some of those announcements. Why did we do it? Because, number one, because we can. We are absolutely confident we'll have the supplies we need locally, but it was the right thing to do. Even though Alberta was at its greatest time of financial need, as we face a very deep and difficult economic challenge ahead of us, we were still able to meet the greatest medical need of our fellow Canadians, and I am confident that that will build a lot of goodwill as we continue to work with the rest of the country to solve some of Alberta's economic challenges in the months to come.
Okay, well, great stories there. Great leadership by AHS with the testing, and our procurement is knocking it out of the park. So it just shows the foresight and the generosity of Albertans. Mr. Minister, I would like you to close with the final two things. First of all, just maybe one more reminder to what we should be doing here at the citizen level in Strathcona County. And also, very importantly, you are a new father. You're getting close to probably 1 year with your son, Max. And I think the viewers want to know what it's like being a dad during a pandemic.
Well, thanks. So maybe I'll start with first, what do people need to do? It's the simple things. Wash your hands continuously, all of the time. Be mindful of what you've touched. Never touch your face until you've washed your hands. Make sure you're washing your hands with soap and warm water, and paying very close attention to being thorough. Don't leave home if you don't need to. And if you have symptoms, do not leave home, no matter what. Fill out the online self-assessment or call 811. Get tested, and by doing those things, we will have a significant impact and we will save lives. Of course, I would encourage all Strathcona County residents to stay up to date. The Alberta website is alberta.ca/COVID-19. This is updated twice daily. It's the most current and up-to-date information about the information on the pandemic, as well as our government's response. And it's also where you can find the daily updates from Dr. Hinshaw and the Premier. And we're all in this together. We will get through this together. If you have more specific questions for related to this, reach out to either my office or my colleague Jordan Walker's office, depending on which riding you're in, and we'd be happy to work with you to get you answers. Thanks for asking, Mr. Mayor. So my son Max, he's 7 months old now, and thankfully he's oblivious to all of what's going on. He's just happy as long as we keep him on schedule for his naps and his feedings, and so he's the best part of my day is when I get to wrap up my work as an MLA and as a minister, and go and help put him to bed or change his diaper, or feed him, whatever it is. Any time with him is the best part of my day. So I think that's a good reminder for all of us. Let's remember what's important. Family is the most important thing. So keep in touch with your family. Look out for one another. Let's look out for our fellow community members, and we will get through this together. And with that, thanks for the opportunity to have this chat, Mr. Mayor, and appreciate all that you're doing and that the county's doing. The leadership you've shown. I think that it's not by accident that Strathcona County has so few cases and so many recovered cases. I think the leadership you've shown has really helped put us in that strong position. So thank you very much.
Okay, well, life carries on, and I guess Max is keeping it real for you, and I'm grateful that you're getting a little bit of a break each day and spending time with your family. So that's it, Strathcona County. Thanks to Minister Glubish for taking time from his busy responsibilities. And until we talk again, look after yourself, look after your neighbor, and stay safe.